Hi! Welcome to Doc Martin's Quarantine video series. I wanted to talk to you today about one of the more common conditions that people see us in our intercare clinics for: knee pain. This video will discuss general concepts about knee pain, and then we'll top it off by sharing with you some of my favorite exercises and stretches to help prevent and treat simple knee problems. There are generally two types of knee injuries, and for simplicity's sake, I will just divide them into two: acute, new, and chronic, something that has been there for a prolonged period of time. Now, acute injuries are normally due to some sort of traumatic event. Either you had a fall, you had a sprain, or a sporting accident, but it's usually related to some sort of event that caused the knee or the structures around the knee to injure. It is best to have these types of injuries evaluated by a healthcare profession that specializes in sports injuries, probably an orthopedist, a physical medicine or rehab doctor, and/or a chiropractor. These type of injuries are usually intense and comes with a lot of pain and inflammation. Chronic knee pain, on the other hand, is more generalized and non-specific, and it's usually due to something that you have heard of before, particularly if you watch my lower back pain video. This is called cumulative microtrauma. The cumulative effect of small, seemingly insignificant things that add up over days, weeks, months, years, the cumulative effect of which can cause pain or injury. Obviously, treatment would depend on evaluating and treating both the cause and the effect. The common causes of stress in the knees could be flat feet, it could be limited mobility of your hips, it could be a pelvic misalignment, or weak core muscles that support the movements of your pelvis and lower extremities. I wanted to share with you some simple ways of evaluating and stretching and mobilizing your knees. Most of these stretches should feel good, and at most you should feel a pulling discomfort. If any sharp pain occurs, discontinue immediately and consult with a healthcare professional. Let's get cracking! Okay, to help me demonstrate this, my favorite quarantine buddy, Elle. Okay, Elle, could you lay down, please? First thing you want to do is just flex your ankles forward and back, just to mobilize the ankles. Any restriction in your ankles will make your knees have to work harder. Okay? Then you also want to stretch the hips, okay? And you do this by just bending the knees and then gently dropping it inside, off to one side, and then the other side. So all you're doing is you're using your body weight to stretch this, okay? Then forward here. Then what you do is you grab your knee and gently take it. So this way you can stretch the knee and the lower back with the same movement, okay? Can you do that on the other side, Elle? And of course you do it on both sides just to balance it out. So this will help loosen up the ankles, hips, and knees, which are very important to help stabilize this whole segment. Now, for this exercise, Elle, we're just going to get a towel rolled up like this, put it behind your knee here. It creates a fulcrum, and then you hold as low down as possible. Turn your foot in, and then jerk it. And that stretches this bone on top of this bone on one side. Then turn it out, jerk it again, and that stretches the other side. Okay, this bone on top of that bone. Okay, now, this is just make sure that the knees doesn't cross past the toes. So you can stand forward here a little bit, here, a little more here. Okay? And then this is just a nice stretch. So you stand up tall and then you just stretch this whole area from here going down here. And then the other side. There we go. Good. Very good. Just warming up and stretching the knees. Okay. Wrap it here like this. Okay, can you get on your knee here also? Okay. Go back down, stabilize. So you plant this like this. Okay. Okay. And then you just bend back. So come back up, L. So the towel is on the top of this bone here, the bottom. And as you bend forward, it pulls the femur on top of the tibia, stretching the knee. So this is stable. Do you feel the stretch in this area? Okay. Back up. And then could you demonstrate it on the other side as well, L? So put the towel behind the knee like so. Plant it on the ground with both your hands, and then you lean back. So you're using your body weight to gently traction and open the knees. Let us know which of these exercises and techniques are working best for you. Remember, this is Doc Martin saying, every day, in every way, you are getting better and better.